initially your first reaction is that you want to you want to be pregnant straight away. You want to be pregnant because you've lost your pregnancy, you want to be pregnant again. But it's not a new pregnancy you want the old pregnancy back. So we didn't necessarily rush into anything straight away, but time wasn't on our side. I was 46 last year, and so time, as I say, wasn't on our side. And to some extent, after Christmas, we lost Tilly on the 3rd of November, and after Christmas I got to the point where I didn't want to be pregnant again. The fear was just too huge of losing another one. So I'd actually gone off the idea, and wouldn't have minded, I mean I would, but I wouldn't have minded if somebody said, well actually, no, we're not going to do that now, you're not going to get pregnant again. I think that would have been a relief, but in the same breath, my age was against me, and so I had to get a move on. And my coordinator in Athens, she arranged for me to have a test in this country, and then she got the results on the Monday, and she phoned me on the Monday night and said, can you be in Athens for Saturday? Which was a bit bizarre, but we went, and it worked. It was initially twins, but one of them didn't make it, so we had Florence. So the moment we were told that it was an inevitable miscarriage and we were going to lose Tilly, I said straight away that we'd have another go at IVF. And I think at this stage my husband was quite shocked, because I'd always adamant that we'd have one go and that was it. But it was nothing like we imagined. We didn't imagine that we were going to lose a baby at 21 weeks. So we did go back, and the 2-week wait, which is when you're waiting to find out whether the IVF has worked, I was in that whilst it was Tilly's due date, which was exceptionally hard. And I found out on Mothering Sunday that we'd got pregnant again. The care that I got was amazing. They really, really looked after me. I had a stitch this time. I had to have a general anaesthetic for that because they couldn't get a spinal block in, which was fine. I didn't mind. And then I had a general to have it removed as well. And then I was induced a week before my due date, but it took 4 days for the inducement. Oh dear. And another thing, please be aware of how fragile a pregnant lady is after loss, because it's so difficult. It's one of the hardest things I've done, because you just won't and don't allow yourself to enjoy being pregnant, to relax. There's no period of relaxation. You're just on tenterhooks all the time. And having lost a baby at 21 weeks, you start to research reasons why you've lost a baby at 21 weeks, and then you find out how many people lose babies further on. So you have all these milestones and goals. So my first milestone was 12 weeks, then it was 21 weeks when we lost Tilly, then it was 24 weeks for viability, and then all the people I've met having lost Tilly through different organisations, I've heard their stories, so I had to get through all their milestones as well. So it's very, very, very difficult. So the pregnant lady needs a lot of care. I got very upset when I went back onto the maternity ward to have my stitch, because it was returning to the place where I'd lost Tilly. And it's just for midwives and nurses to be aware that the pregnant lady is very fragile. But we've got Florence now. We have a picture of Tilly on the wall. If people say, is she my first, I never say yes. I say no, she's my second, and then I explain the situation. sometimes I feel that people are thinking, they've never ever said it and they've never even suggested it, but I often think that they think I'm okay now because I've got Florence, who's alive and well. But you're never the same again because you lost a baby. And that needs to be remembered as well, that you're not fixed, you're just different. But Florence will know all about her sister. We'll make sure she knows all about her as she grows, so that she knows she's not on her own, bless her.